When you give birth, either you give birth to a girl or a boy, they don't do circumcision at the hospital like back home, and they don't do piercing of hair immediately at the hospital. You have to register after 3 months. When the baby is 3 months, then you do it, or you go out and do it at registered places. Make sure it is registered center because of anything. Hi guys, welcome back to my YouTube channel. If you are new here, I welcome. My name is Adedoyi and you guys are welcome to my world. So in today's video, I will be talking about childbirth in the UK. After you might have given birth to your baby, they don't usually keep people at the hospital. Like some people, they discharge them the next day. That day, I was discharged the next day, but I didn't come on until the morning of the third day because of my paperwork. I think one of the nurse thought the doctor still wants to see me, so something like that. The care that was given to me to when I gave birth was top notch. Tried to regulate my BP. Even up to now, I'm still meeting with the GP to check my BP. So this is another thing that I actually love again. Back in my own country, after you might have given birth and gone home, you don't have any business, nobody's checking up on you. But here, the third day, they will come and meet you. The third day after you left the hospital, they will come home to come and check up on you, weigh your baby, check the feeding, check her weight, check how you are feeding and everything. Then 2 days after, they will come again. Then 3 days after, they will come. They will monitor the baby. They know the weight they want. So until that baby meet up with that weight before they discharge you. So after the midwife has discharged you, health visitor will not take over. They will come, give you vitamin D, multivitamin for yourself, for your baby, give you the necessary stuff that you need, and they come and ask you about your welfare. They are checking, always checking. Then they will come when the baby, I think the first month they will come at second month again. And after that, they will come when the baby is 1 year. So the health visitor will take over from that 1 month till when the baby is 4 years. I think it's a very beautiful thing. The first 2 weeks after you give birth, they come and do different tests. They will take your baby's blood sample to check for different kind of syndromes and everything. They will do different kind. Then after, they will send you the results, and I think maybe if there is concern, they will call you. But if there is no concern, they just send you the results. Us, they just send us the results, and everything was normal, 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 normal. We actually did some scan as well because how my baby came out. So we did some scan to check for any abnormality. So if there is anything, they check, they do scan, they do scan, they do scan. And after everything, they'll tell you, is it normal? If it's normal, you're free to go home. And if there is any need for them to do something, they will actually do it. Then I received a call from breastfeeding club something. They are in charge of breastfeeding. They will teach you how to breastfeed. Their concern is just breastfeeding. Here I discovered that so many people are not doing this exclusive breastfeeding from the breast. So some are using bottle, just about your welfare and the baby. The care is actually top notch. I will not lie. It is, and I really love it. To me, I'm actually happy that I made that decision that I'm not going to give birth once I get to this place, and the experience has helped me a bit to overcome some trauma that I had from my past experience. Then when you want to do your baby registration, you have to go online to select. They will give you a date, 16 days or something. I've forgotten now. So they will give you a date and a time for you to come to the council to come and register your baby's name and everything. Just do it, and they give you your baby birth certificate. They don't do all those stuff at the hospital like our home. I think that's one of the things that is different. Another thing that I find shocking is, I won't say shocking because I've heard about it. They don't bath baby like in my own country, that after giving birth, they'll bath baby. No, no, no. Here, I wash my baby, all those stuff that is on their skin. I wash the skin, absorb everything. So when I got home, that I bathe my baby and everything. So unlike back home that they will bathe your baby at the hospital. No, yeah, no. You do body to body, and you are free to you are free to go. When you're in Rome, you behave like Romans. So many things that is so different from what we are used to. Then the baby placenta will ask you what you want to do with baby placenta. I think that one is still similar with our own. Same. So you are in charge. You know what to do with it. Either take it or give them for biomedical stuff. They blend it. They use it for all this medical stuff, or you take it home to go. Whatever you want to do with it. If you're having CS a few days before, they tell you the time. They remind you. Ask you for the medication that you're taking. They will tell you things and things that you are supposed to do before that time. Then a day before, they will call you again to remind you. Then when you get to the hospital, the surgeon, everyone, they will come and introduce themselves to you. Then when it is time, they come give you clothes. Then you follow them to the room. And when you get to the room, every one of them too will introduce themselves. Yeah. So I think I just love the way I love it. There is this involvement. I love it. So I think I love the involvement, the way everything is just about you as the woman. Back home, someone they were like, yeah, your husband must be. No, 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 no. It's all about you. It's about you because it's your body. In fact, sometimes when they call my husband and I'm not there, they ask him to get the phone to me. They want to speak to me. At times I don't find it funny because my husband is my partner, so you can tell him no, but they will even ask you, are you comfortable with him being with you on the phone? You say yes, okay. It is all about you. So I think I've given a very explicit explanation on childbirth, pregnancy and childbirth in the UK. If you are confused, if there's any other thing you need to know, let me know at the comment section. But I think I've touched everything basically. You don't really need much, except for you carrying your baby and you don't have any complication and anything. Everything is, other things is smooth, and they follow you up, and delivery is free. Childbirth is free. It is the childcare that is not free. Another thing I find so funny this place, Pampers is cheap. It's not expensive. It's cheap, but baby food is not that cheap. Oh. It's not cheap. I think this video will help some intending mothers, for people that want to know, that want to have an idea about childbirth and pregnancy in the UK. I think this video is going to help you. Thank you guys for watching. This is going to be the end of this video. I really appreciate you guys for watching thus far. Please, if you are yet to subscribe to this channel, I'm begging you, click on the subscribe button and turn on your notification bell so that when I drop a new video, you'll be notified immediately. Thank you guys. I'll see you in my other video. Take care of yourself and be good. Catch ya. Bye bye.